It's time now for our morning rounds, our look at the top medical news of the week. Joining us are CBS News chief medical correspondent Dr. John Lapook and CBS News contributor Dr. Holly Phillips.
First up this morning, trans fats are the ingredients that make many processed foods taste better and last longer. But this week, the Food and Drug Administration said trans fats are no longer recognized as safe, and the FDA intends to ban them. Chip Reed spoke with FDA Commissioner Dr. Margaret Hamburg.
Trans fats increase your risk for heart disease. It turns out that they elevate the so-called bad cholesterol, LDL.
Will this save lives and avoid heart attacks?
This action will save lives. The CDC estimates that if we can reduce the levels of trans fat currently in the American diet, we can probably save about 7,000 people from preventable death and prevent about 20,000 heart attacks.
Trans fat is created by turning liquid vegetable oil into fat. Processed food manufacturers use it because it extends the shelf life and improves the flavor of some foods, including snack foods such as microwave popcorn, crackers, and cookies, packaged soups, cakes, pies, and biscuits, stick margarines and vegetable shortenings, and ready-to-use frostings. And some restaurants use trans fats in fried foods. The food and restaurant industries are doing little so far to resist the ban, noting that they've been voluntarily reducing trans fats for years. In 2003, Americans consumed 4.6 grams of trans fats a day. By 2012, it had plummeted to 1 gram a day. But the FDA says there is no safe level of consumption.
John, trans fats have been used in food for decades, so why is the FDA taking action now?
Well, there has been this movement, Anthony, towards getting it out of our supply. And there has been about a 75% drop in the consumption of it in recent years, but it's still not down to zero, and even a little bit can cause heart disease. It can be anywhere, you know, it's not like a pack of cigarettes where you see it and you know what you're doing. It's kind of invisible, and we're not quite sure what products have it. So the FDA is finally just saying, you know what, we're taking it out.
It feels like here in New York, we've almost been a case study. We've seen restaurants eliminate it, but the real question is it working?
It is working, and in fact, people were so frightened at the beginning that it was going to crash the number of people that were coming into these restaurants, and it hasn't done that at all. In fact, in other countries like Denmark, Iceland, Switzerland, that have entirely gotten rid of it for years, there's been absolutely no problem. And you know what? It tastes just as delicious. You can put other things in it that give it the flavor.
Interesting. Also this week, a new study in the journal Pediatrics says the age at which some girls begin puberty is dropping. Researchers followed more than 1,000 girls for 7 years. They discovered that the onset of breast development is directly related to a girl's body mass index. The heavier the girl, the earlier puberty is likely to start. Holly, I was so fascinated that BMI is a bigger predictor than race or ethnicity.
Absolutely. You know, this study did break it down a bit by ethnicity, but for everyone, puberty started surprisingly early. So for Caucasian children, it was around 9.7, girls in particular. And for African American girls, it started at about 8.8 years old. Those are really, really early ages. But the biggest predictor, again, was obesity and your body mass index. And that's because fat cells really trigger hormonal cascades. They trigger the release of hormones that wouldn't be there otherwise, and that causes puberty to happen much earlier.
So how do girls this young cope with developing so fast?
You know, Anthony, not so well. It's really very challenging for them. Some of the studies have shown that they have lower self-esteem, they perform more poorly in school, even greater rates of depression. You know, I feel like childhood is such a fleeting time. You know, I don't want my children to get any older at all. I sort of feel sad at every birthday that they have. But, you know, really, one of the things we have to focus on is making sure our children are healthy, that they are not obese, so that their bodies develop at the same time as their minds. And that's really what's most important.
Another new study could make men think twice about testosterone therapy. As John reported this week, research shows a link between that hormone treatment and serious health problems.
When restaurant owner Luca Marcotta started feeling tired, he asked his doctor to check his testosterone level.
I did not have energy right in the morning. You know, in my business, you have to go and go and go and go.
His levels were low, and his physician prescribed a gel containing testosterone.
And now I feel the way I should be feeling.
Low testosterone levels are linked to problems like fatigue, muscle and bone loss, and decreased libido. While replacement therapy is FDA approved for some conditions, it's widely marketed as a way to improve health and stay young. But there's little data on its long-term effects. Today's study looked at older men, most with heart disease, who had low testosterone levels. There was a 29% increased risk of heart attack, stroke, or death in those given testosterone. Cardiologist Dr. Steve Nissen of the Cleveland Clinic says we need better studies to assess the benefits and risks of testosterone therapy.
Just like women go through menopause, men go through menopause. And that's probably a normal part of male aging. And treating it as a disease may get us in a lot of trouble.
Urologist Dr. Elizabeth Cavalier says the decision to prescribe testosterone is complicated.
There are risks that are associated with having low testosterone, and there are risks associated with testosterone replacement.
Before you start treating millions of Americans with testosterone, you probably ought to think twice.
John, those ads for low T, as they call it, are everywhere. Is marketing part of the problem here?
Well, it's a booming industry. We're talking about more than 400 million prescriptions written last year and more than $2 billion spent. So yes, and without having the long-term safety data, that's where it's of concern.
Holly, what about women? We hear so much about hormone replacement therapy for us.
Absolutely, and of course there are dangers just as with men. I mean, I think it brings us to the moral of the story, which is just that we can't fight nature as much as we would like to. And I think those hormone levels are supposed to drop as we age, and we should let them.
All right, finally this week, there's good news for adults who suffered through music lessons as kids. It turns out that early musical training has a lasting positive effect on the brain. Researchers at Northwestern report people who took at least 4 years of lessons as children have faster reaction times to sound. That faster reaction time may help prevent cognitive decline, even if they haven't played an instrument in decades. So I should have taken the piano lessons?
I took piano lessons for 3 years. Missed it by that much.
That explains this decline.
I did it 4 months. So
I did it for about 18 years. I live forever.
Good to know. Dr. John Lapook, Dr. Holly Phillips, thank you both.